Hi everyone. In this part, I will be starting with the remaining part of the mediastinum. So let's get started. So we are starting with the blood supply. Means first of all, blood supply. Although it does not supply to the mediastinum, because mediastinum क्या होता है? It is just a space. The space doesn't have any blood supply. So these are the blood vessels. We are starting with those blood vessels which are passing through the mediastinal part, mediastinal space. So let's get started. First is superior mediastinum and second is inferior mediastinum. सुपीरियरली फर्स्ट ऑफ ऑल सुपीरियरली देखते हैं हम. तो सुपीरियरली क्या होता है? ब्रैकियोसेफेलिक trunk. It means it is a direct branch of arc of aorta, and also left common carotid artery, and lastly left subclavian artery. Since जैसे कि आप जानते हैं क्या होता है? आर्क ऑफ आयोटा होता है. आर्क ऑफ आयोटा. तो आर्क ऑफ आयोटा क्या के मेनली 3 ब्रांचेस होते हैं. मेनली 3 ब्रांचेस निकलते हैं. तो फर्स्ट ऑफ ऑल जो राइट साइड को जाता है उसको क्या बोलते हैं? ब्रैकियोसेफेलिक आर्टरी. It further continues to left subclavian vein and also a branch. It further continues to the right subclavian artery and a branch that is called as a right common carotid artery. But on left side, it is a direct branch, that is left common carotid artery that goes in the neck region. And lastly, left subclavian vein. Clear? Next is anterior mediastinum. Anterior mediastinum किसका देख रहे हैं हम? inferior part का. So inferior mediastinum में फर्स्ट हम देखते हैं anterior mediastinum का. So anterior mediastinum का ब्लड सप्लाई देखते हैं. So anterior mediastinum में क्या रहेगा? Mediastinal branches of internal thoracic artery. Internal thoracic artery. Okay. Next, middle mediastinum. It doesn't supply to the mediastinum. It passes through the, that is for example इधर हमने देखा इंटरनल थोरैसिक आर्टरी. तो ये सप्लाई नहीं करेगा. क्या करेगा? ये सिर्फ पास करेगा. इसके थ्रू एंटीरियर मीडियास्टिनम के थ्रू. नेक्स्ट हम देखते हैं मिडल मीडियास्टिनम में इधर क्या होता है? डिसेंडिंग थोरैसिक आयोटा. डिसेंडिंग थोरैसिक आयोटा होता है. एंड लास्टली हम देखते हैं क्या देखते हैं? पोस्टीरियर मीडियास्टिनम. posterior mediastinum. पोस्टेरियर मीडियास्टिनम को क्या रहता है? मेनली पोस्टेरियर मीडियास्टिनम को भी थोरैसिक आयोटा. So clear about the blood supply. Next is venous drainage. Venous drainage. So what are the major veins that are passes through the different parts of the mediastinum? Superior and inferior. So superiorly क्या पास करता? Superiorly right and left brachiocephalic vein. Superiorly क्या पास करता? Right and left brachiocephalic vein. ठीक है, right and left brachiocephalic veins, and also upper half of superior vena cava plus upper half of superior vena cava. Now inferior part. Inferior part is divided into three parts: anterior, middle and posterior. So first of all, anterior. So anteriorly क्या प्रेजेंट रहेगा? Internal thoracic vein. Internal thoracic vein. In the mid part, in the middle part, mid part में क्या प्रेजेंट रहेगा? Pulmonary trunk. Pulmonary trunk, that is a part of the heart. Pulmonary trunk. And also azygous vein, terminal part of azygous vein. And posteriorly what is present here is posteriorly azygous vein and hemiazygous vein. Azygous plus hemiazygous vein. So we have completed with the venous drainage also. Next is nerve supply. Nerve supply. So you can directly write here is splanchnic nerve, plus vagus nerve. You can directly write as vagus nerve. That's it. And lastly, lymphatic drainage. Lymphatic drainage. So इसमें हम देखते हैं posterior mediastinal lymph node. Mediastinal lymph node and lastly thoracic duct. It is also important topic in the lymphatic system. इसको हम separately देखेंगे. And lastly clinical aspects. So first of all, cervical mediastinoscopy. Cervical मीडियास्टिनोस्कोपी। तो सर्वाइकल मीडियास्टिनोस्कोपी होता क्या? It is done to visualize. It is done to visualize the lymph node and biopsy of the same. Next is mediastinal syndrome. The word syndrome means group of symptoms. Group of symptoms. In this part, that means in mediastinal syndrome, the compression of mediastinal structure occurs. Mediastinal structure occurs, resulting into group of symptoms. Group of symptoms. That is, some symptoms are there. Bronchogenic carcinoma. Bronchogenic carcinoma. Next is Hodgkin's disease. Next is mediastinal tumor. And lastly, aneurysm. The word aneurysm means dilation. Dilation of aorta. Next is dysphagia. Dysphagia is a condition in which there is a pressure. When there is a pressure on esophagus. When there is a pressure on esophagus. So that condition is called as a dysphagia. And some other points are paralysis of diaphragm. Paralysis of diaphragm due to pressure on phrenic nerve. And lastly, pain in the chest due to pressure on intercostal nerves. So we have completed this topic.